Thanks so much for joining us for another segment of DermTube Daily Coverage from Maui Derm 2015. With us today is Seemal Desai, who is a clinical associate professor at UT Southwestern, and he's been discussing cutaneous manifestations of systemic disease at Maui Derm. Can you walk us through some of the salient points from your presentation?
Absolutely. Well, thank you for having me here, Joel. And this is a very interesting topic, and one of these topics that contains a variety of diseases that are both rare and somewhat more common for the practicing dermatologist. And what I really was trying to do is highlight some clinical features that any of us who see patients in a busy clinical practice can do to hone in on patients who may have an underlying disorder, specifically a systemic malignancy.
So things that we remember from board exams and hopefully never see in our practice, things like signs of lesser Lod or some of the other paraneoplastic symptoms. Can you talk to us a little bit about some of those things that you covered?
Absolutely. So one of the most common things that I think we see in a practice every day is patients who come in complaining of dry skin, who just have the common xerosis of the lower extremities or the legs, and those patients who also have more of an ichthyosis or ichthyosiform-like dermatitis. Well, ichthyosis isn't something necessarily that we should always discount. Now, I'm not saying that everyone who comes in with ichthyosis on the legs needs to be worked up for a systemic malignancy, but the point being is that if you have patients who come in with new onset acquired ichthyosis, like skin changes on the legs, especially patients who are in their 5th, 6th, or 7th decades that aren't improving with your standard therapies, alpha hydroxy acids, emollients, things like that, you should hone in on at least to make sure these patients have had a good workup for other health maintenance things, including colonoscopies, breast exams, lung and chest x-rays, and things of that nature.
So other specific regions like thickening of the palms, Howell-Evans, there's certain things that are very, very diagnostic of something else going on. Are there other symptoms like that?
Absolutely. So we talked about a case of a patient who actually presented with tripe palms, which is somewhat rare, but when you do see it, you'll never forget it. This is sort of a hyperkeratotic condition of the palms. It's typically only associated with lung cancers, but more commonly, you may see acanthosis nigricans in your clinic, and we all know about acanthosis nigricans being associated with obesity, with insulin resistance when it's classically seen in the axillary areas on the neck. But when you see it in areas that are not classic, such as periumbilical or even perioral, your antenna should be attuned that something systemically could be going on. Specifically in that case, when you have acanthosis nigricans along with tripe palms, you really need to think of a gastric carcinoma, especially of the digestive tract.
So typically when a dermatologist in the community suspects something going on, are they working in concert with the internal medicine physicians, or are they going directly to an oncologist for these types of workups?
You bring up a great point, and that's really one of the points of this session, is to really demonstrate that we as dermatologists can be the ones who are saving lives here. We are the ones who oftentimes are diagnosing these things. Many of the things we talked about, the skin manifestations actually precede the diagnosis of the tumor. So we have a really important role here that we can actually proactively help these patients get diagnosed with their cancer. We talked about a case of a patient who presented like psoriasis. Turns out the patient actually had Bézek's syndrome, atypical presentation of psoriasis in the 6th or 7th decade, not responding to therapy, phototherapy, topicals. Think of doing a systemic workup. Patient had prostate cancer, was treated with prostatectomy, skin signs resolved. So we as a dermatologist, I think, really have a role to play in the medical community here, working in concert with the other referring colleagues.
So I think when it comes to ordering specific imaging studies on our own, sometimes we're apprehensive because we want to make sure we're ordering, obviously, the right test. So are there specific derm chat rooms or other areas where you find useful to present to other colleagues that may help highlight some of the studies that may be important?
Absolutely. So the Medical Derm Society has a great online forum for dermatologists to communicate with each other about these sort of specific newer lab tests. In the era of cost-conscious medicine, we're constantly under scrutiny about ordering things that are only cost-effective and necessary. But my really standard workup includes a regular CBC metabolic panel. Chest x-rays are very inexpensive and are very, very helpful studies, especially in patients who have systemic itching or patients who you do want to make sure they don't have any lung pathology. I've even ordered CT scans. Those are very inexpensive now, and even MRIs. Now, if I get to the level of ordering some of these more expensive tests, I am going to have that discussion with the primary care doctor and see if they want to do it or if I'm going to do it. But I don't think we as dermatologists need to be afraid to order the tests in the right setting.
We appreciate you joining us, and thank you everybody for joining us for another segment for DermTube Daily Coverage from Maui Derm.